Hi guys, welcome back to our channel, and we are back again with Miss
Chile.
Yay.
Hi guys, welcome back.
We're talking about cancer this time. Last video we talked about the caregiver of a cancer patient. So today we're talking about getting like a cancer diagnosis and how life-changing it is. Guys, for those people who are able to do routine checks, and I know first world people in the first world countries are usually able to go to their doctors and get checked. And so if cancer is caught early, you got better outcomes. And usually you'll be caught by accident. You have no symptoms. They're like, something is off. Let's get further imaging. Let's investigate further. And then they catch something. But by the time you're starting to see symptoms, it's usually a little bit advanced. So what are some of the things that should trigger you to go get checked?
Weight loss over more than 30 pounds is a trigger that something is off. Loss of appetite. If usually you love to eat and suddenly you don't feel like eating.
Yeah.
Not just for one day, not just for 2 days, you notice that you've reduced in the quantity of food that you eat. And also pain. Most times pain in a certain area that increases despite most home over-the-counter pain managements.
Yeah.
And that pain will be on that spot for a longer time. You might take pain management over the counter. It disappears for a while, maybe for a few minutes, for a few hours, and it still comes back on the same spot. Also, some people will see nausea, vomiting.
Yeah.
Some people they can't keep anything down, and all that depends on the kind of cancer you have.
Yeah. So then, when you feel like you've lost so much weight with no intention of losing weight, and you have a pain that's beginning to bug you, you should definitely get checked. All right. So to get that confirmed diagnosis, your team is going to do so many things: lab tests, a lot of imaging, ultrasounds, CT scans, MRIs, so many, just to confirm, and then they'll do biopsy, of course.
Yeah.
Once they've identified a location, and to confirm what kind of cancer it is and what stage. And like we said, guys, if it's detected earlier, which usually happens by accident because there's no symptoms at the time, then you have better outcomes. But then by the time you're showing symptoms, having pain, weight loss, nausea, vomiting, it's usually advanced, at least stage 3s, 4s. And then your outcomes may not be as good, and you go through so much. And even your treatment options change. So usually when they catch it at stage 1, stage 2, the options might just be surgery or just chemo.
One section or so.
Yeah, and then we're done. But when it's stage 3, they may have to combine chemo and radiation.
And then longer cycles of chemo.
Yes, longer cycles.
Probably
of
not
chemo.
just one cycle.
Yeah.
You might go through 2, 3.
Yeah.
Or you might go to 2 cycles, go for surgery, and return back to chemo or radiation. So it's a longer
and even after the chemo and the radiation done to shrink the tumor, you may still need surgery. After that, you may even need immunotherapy. So definitely listen or work together with your professional medical team, because they will guide you. So getting that diagnosis for anybody is very, very shocking. It's devastating. A lot of people might feel this is the end.
Well, they might feel exactly how it feels.
Feels like you're dying. And at that time, some people might cry. So if somebody has gotten the diagnosis and they're crying, don't stop them from crying, because crying can be cathartic. It might be just what they need. So allow them to cry. Let them know it's okay to cry, because it's therapeutic. And then you go through this process of anger, acceptance, denial, because it's just it's mind-boggling, it's shocking, it destabilizes you. It destabilizes you. So then you starting the treatment. It's so important to have a support system.
Yes.
If say let's say somebody's married, and then you have, it's very important to have the support of your spouse. And I know there are people who, and if you would do this, you better stop. If when your special someone is diagnosed and they're going through treatment, for example, men, that's when you decide to see other girls out there and start seeing other people. That is not the right time. It is not
even
right time.
not even the time to lay blames, to point at faults.
Yes.
It's a time for tolerance.
Yes. Yes, it doesn't matter how long they smoked or how long they drank. I mean, cancer gets even people who've never drank or smoked.
Oh yeah.
Or lived in an area with so much radons.
Yes,
So,
because they're just trying to find a sitting spot.
Yeah.
It might be through drinking.
Yeah.
Maybe it makes them sleep more.
Yeah.
And it make them sleep more without thinking about the problem.
Yeah.
Maybe smoking.
Mm-hmm.
In as much as they are not a healthy way of really easing off stress.
Yes.
Instead of putting a blame, find a way to welcome them and redirect them to a healthier way of releasing the stress.
Yes.
But don't blame.
Mm-hmm.
Don't add more fuel to the fire. You know.
Yeah.
Don't do that.
Yeah.
You have to find a better way to suit their pain at that time and take them off what you think they're not doing right.
Yeah.
But don't blame.
Yeah.
Don't nag.
Yeah.
Don't add more problem to what they're already going through.
Yeah. If you're a lady friend to somebody whose wife is going through cancer, don't cozy yourself up to this man as a way of comfort. Find a way to comfort the family, respectfully.
Yes.
You know, obviously clean behaviors. You know, don't start drinking more than before. It's stressful for everybody. But this sick person needs a support system. They don't need people to go get messed up trying to deal. Find out healthier ways to deal with the problem, with the situation, because it's affecting the entire family. If there are kids involved, they're also being affected. So who's looking after the kids? Emotional needs. Who's being the kid support system? So when you have relatives, you know, relatives can come in and give support that way, right? You can choose to stay, be with the family, spend time, listen to them talking, listen to them crying, relieve the primary caregiver, whether it's a parent who has moved in or a spouse.
Or a sibling.
Yeah, or a sibling. Anybody involved in that care, just be there for them, be a support system. Obviously, while going through treatment, coordinate with your providers about nutrition. Ask for a nutritionist and consult with.
Yes.
Yeah, but what are some of the things that you can eat? Because, you know, people during this time, people forward a lot of stuff that are not even confirmed.
Yes, a lot of, in fact, things that will even hasten up the growths. So if you're taking all those advice of home remedies, you have to be careful. You're going through chemotherapy, be careful of what you're taking in, especially your vitamins.
Yes.
Most vitamins will hinder the effectiveness of chemotherapy. Some people will tell you to take your vitamin C, vitamin D. Make sure you discuss all the vitamins and home remedies you're taking with your healthcare team.
Yes.
One of the foods that I have seen that is that has been very helpful in rebuilding your energy, because chemotherapy takes off that energy.
Oh yes.
It knocks the person off.
Yeah.
And also it kills your good cells. One food that I've seen, I think is very, very helpful is the beets, the beetroots. The beetroots is a very high antioxidant food. It helps you, it builds your immunity naturally.
Yeah.
You don't have to start taking all these, some people want you to go buy the immune support drugs.
Yeah.
Vitamins, I think when you're going through cancer, go through the natural way of supporting your immune system
Yeah.
than the drugs. So
Yeah.
because those drugs will hinder, if you're on chemotherapy,
Yeah.
those drugs will hinder the effects of chemotherapy.
Yeah.
And then it's like you're left for the vitamins to help you when you actually need that chemotherapy to reduce the at least to stabilize it. Even if it's an advanced, chemotherapy can help to stabilize. And if you're lucky, your body reacts well, chemotherapy can also put you in remission. So, but at least you need that chemo to work very well.
Yeah.
If you're taking it, you got to do all it takes
Yeah.
to help your body to make good use of the chemo.
Yeah.
And also, the beetroot I'll tell you, the beetroot is the #1 food, is a must-have if you're going through cancer. The beetroot is a must-have. And also the berries, all sorts of berries, blueberry, blackberry. The berries are very high antioxidants. And you can also do the smoothies, the green smoothies to boost your blood level. Most people going through cancer get anemic.
Yeah.
Most times, depending on the kind of cancer you have, it's of your good cells. Not just the white blood count, but your hemoglobin gets low as you go through.
All your blood
numbers
go
get crazy as you go through cancer and chemotherapy.
Yeah.
So you can most times use the natural food to boost your immune system, get your blood levels back up. You can do the spinach and kale. Spinach and kale, they are really rich in iron. You can blend them, make smoothies. They are not really pleasant to take. So you can start mixing it up with the berries. Berries taste much better than the spinach and kales.
Yeah.
So you can do blend the berries, the beets, and the greens, mostly the spinach and kale. Brussels sprouts are good because these ones are very high in irons. Spinach, kale, Brussels sprout, if you can have it.
Yeah.
And mix it a little bit with the berries to change the taste.
Yeah.
And also, because for some people, chemotherapy, even the cancer process, and then chemotherapy will even make your appetite worse. Most times it decreases the appetite. And that's what makes it more even the person more vulnerable to lose more weight.
Yeah.
Some people, not just the cancer making them lose weight, they tend to lose more weight and get more weaker with the appetite, loss of appetite, chemo getting them weaker with the immune system. They are prone to infections because their white blood counts and their platelets are down. You can do high protein foods or high protein drinks, the shakes. If you're able to have the greens blended, berries, protein shakes, you can see you have full course meal right there and very nutritious, supporting the person. Not forcing them to eat your regular food. Most of them might not have the strength to chew, the strength to eat a whole bowl of food. But if you have the rich foods, natural foods, even if it's a glass 3 times a day, you put a glass of protein shake and a glass of your smoothies with the veggies and the berries. That's real good meal right there.
Yeah.
And you space it out like that. Some people with the chemos might have the gingivitis, the gums are bleeding, the teeth can't even hold a bite. So the smoothies and all these soft foods and drinks makes it better. And also having enough fluid down.
Yeah.
You know, getting your hydration during chemotherapy helps a whole lot.
Yeah.
The chemo drugs are not meant to sit in your system. They are meant to go in and go out.
Yeah.
The longer they stay in you, the more damage they cause in you.
Yeah.
So as soon as you get the chemotherapy, you want to take a whole lot of water.
Fluids to flush your
When we're talking about fluids, we're not talking about just this.
Yeah.
You might not just this. This is not enough. You might want, if you take this, you might want up to 8 bottles of this a day, or even more.
Yeah.
8 or more a day.
Yeah.
because you want to flush your system. You don't want to sit in your kidneys.
Yeah.
Yeah, that's one side effect of the chemo. Chemo can kill your kidney.
Yeah.
It can shut it completely down.
Yeah.
And that's another problem that you don't want to get into.
Yeah.
So to avoid that happening, you want to make sure you're having enough fluids.
Yeah.
And the real enough fluids, 8 to 10 of this
Yeah.
a day.
And that's a lot. And when we're talking about this, because of the disease process and because of chemotherapy, you may not be able to keep food or fluids down.
It's
so
hard.
If you are home and for 3 days, 4 days, 5 days, you're not able to keep any food or drinks down, I would go into the hospital so you can get IV. The sooner the better.
Yes.
So you can get IV fluids, maybe even IV nutrition. To supplement your nutrition. And even eating regular food might be difficult.
Okay.
And here in America, we have things like Ensure and Boost being like the most popular supplements. I know they have the Ensure in Kenya.
Yeah, they do have those. Yeah, they do have those supplements. I can. When I was in Nigeria, I know in those days, prior to nursing schools, my grandparents used to take Complanner. And I'm like, Mommy, every day my mom would be like, I can't find, even though it's so hard to find a Complanner in most of the supermarkets. So my mom at times will go to 2-3 different supermarkets and come back home. I can't find Complanner because the dad only takes Complanner. I'm like, what's the difference? So now I understand what that means.
Yeah.
So you can try to get it. They might call them different names depending on the country, depending on where you're coming from.
Yeah.
The most important thing is it have to be a high protein diet.
Yeah.
High protein diet. Avoid processed foods. Avoid sugars.
Oh yes.
Those when you high sugars, you're feeding your cancer cells. So you want to avoid sugars. You want to avoid processed food because most processed foods tend to have sugars in them or preservatives, and you want to avoid those. And also, if you're diabetic, you want to make sure your glucose level stays low at all times, because with high blood sugar and high insulin, you are enhancing the cancer cells to keep growing.
Low, but within the normal range.
Yes,
right?
you have to keep it under control.
Yes, under
you
control.
want to be able. So if you get diagnosis of cancer, you want to make sure you see your endocrinologist to manage your blood sugar right.
Yeah.
You want to keep it low.
Yeah.
You want to make sure the blood sugar stays low at all times.
Yeah.
I'm not saying low as in low, keep it normal.
Yeah, normal range.
Keep it normal range. And you know the normal range is 70 to 100. So you want to keep it that way.
Yeah.
If you're already diagnosed, you can go a little bit above 100, but not up to 750. I mean 150. Do not go up to 150.
Yeah.
But anything lower than that, you can keep managing that.
Yeah.
So another thing too to avoid is red meats. You might go to lean meats, white meats.
Yeah.
Avoid red meats.
Yeah, avoid red meat. And also, while you're starting treatment, a lot of changes are happening to your body. For example, the most common one that everybody's aware about, your hair falls. I remember with my mom, just after the first chemo treatment, all of the hair was like, you would touch her head and you have like chunks of hair falling off. So a lot of people might prepare themselves by just getting a haircut before chemo, you know, so that you're not shocked or surprised. But the hair falls, the eyebrows fall every part of your body.
Yes, everywhere. Your pubic hairs will be gone.
Yeah, they eventually grow back when you're done with chemo. But the color of your skin might change. You might be darker. The nail beds will be darker. Of course, you're having nausea, vomiting. Going through treatment, you're getting maybe even still skinnier.
Some part of your skin might show like you have a sunburn because the chemo at times will give you heat, like you have an internal heat.
Yeah.
Some part of your skin will have a sunburn.
Even radiation, you will see wherever they're targeting, you will see like burns. And even skin issues if you have fragile skin. So those are some of the signs.
And for the skin issues, I I think aloe vera mixed with gold bonds helps a lot with if you're having a skin burn from chemotherapy.
Yeah.
You're having skin issues from chemotherapy.
Yeah.
Mix aloe vera gel with gold bonds lotion. It helps. It clears it. In 2 to 3 days, your skin looks better again.
Yeah. So in addition to all the physical changes, and of course, your doctor will give you a schedule of your chemotherapy, your lab work, your imaging to just check the progression of the disease, if you're getting better or not, and that kind of lets them know if they need to make any changes in your therapy. So you follow that regimen. And like we talked about the blood numbers, your blood numbers might be killed by chemotherapy. Your white count might be so low that you have to get extra shots to improve your white count. You may even have to get blood transfusions to bring your blood numbers up. But in addition to all that going on with your body, there's a lot of mental and psychological as well. Depression. People going through cancer have known to go through depression. Yeah.
And their loved ones too.
Yes,
it
and
can
their loved
happen.
ones too. So it's important to give them that support. Like you were saying earlier, don't be the cause, don't add fuel into the fire. So in summary, guys, pay attention to your loved ones. Pay attention to your body so that you will detect if something is off. You know, unintentional weight loss along with a pain somewhere. Just be cautious of that so that you can get checked. Hopefully get an earlier diagnosis, right?
Yes.
And once you get your diagnosis and you start your treatment, stay on your treatment with your provided by your team. Be mindful of the forwards on WhatsApp that are coming left and right. Oh, drink lemon every morning to cure cancer. Things like that.
Drink ginger.
Drink ginger.
Yeah, mind you stay away from spicy food if you're on chemotherapy.
Yeah, avoid spicy
foods.
Drink aloe vera. Yeah, be mindful of things like those. And just follow what your team is advising you to. Request for nutritionists to be on board so they can suggest things that are not things that will help with the nausea and vomiting and help you put in more calories. And then just be supportive. If you're a caregiver, take a break, because if you recharge yourself, then you are more likely to be a better caregiver than somebody who is exhausted and burnt out. You might
do some of the things that makes you happy.
Yes.
Not necessarily thinking about how people around you feel about it.
Yeah.
If that is a way of you venting and getting your relaxation.
Yeah.
Do what makes you happy. Take a break. Get a massage. Go to restaurants. Take a walk. Yeah. Do things that make you happy.
Yeah.
And stay around people that can ease off your burden. People that can lift you up.
Positive energy.
Positive energy.
Yeah.
You know, positive energy around you.
Yeah. Yeah.
Avoid those ones that will bring you down. Avoid those ones that get you scared. Avoid those ones that put more of fear into you. All you need is just positive energy. You can't get enough of them.
Yeah.
Keep getting them.
Yeah. All right, guys, that is it for today's video. Thank you so much for watching, and we'll see you in the next video. Bye.
All right.